My name is Dr. Joy Field, and I'm an endodontist in Plano, Texas. One question people commonly ask me is, what is an endodontist? An endodontist is a dentist that has been additionally trained to save teeth that have become damaged into the roots. In fact, in this one area of dentistry, endodontists are trained to the highest level. So an endodontist is a root canal specialist. For a dentist to specialize in endodontics, they must first complete the standard 4 years of dental school. Afterward, they make the choice to go back and do a residency for 2 to 3 more years, which is totally focused on the science of the roots of the teeth, diseases of the roots, and performing the root canal procedure to the highest level. Just like our eyes, our skin, and our bones, through time our teeth experience wear and tear. We're human. Most people have at least some hard or crunchy foods in their diet, whether that's chips, crackers, nuts, or other hard foods. There are also lots of foods that even though they're healthy, they're acidic, and that acidity can weaken the teeth in that way. So, through time, the tooth structure experiences wear and tear from what we eat and any grinding or clenching we do to our teeth as well. The anatomy of the tooth includes a hard exterior surface with a hollow core where the blood vessels and nerves live. This internal soft tissue is called the pulp, and it's very fragile. It needs the hard exterior tooth structure like an armor to protect it. Only about 1/3 of the tooth is visible above the gums. The roots that aren't seen are the very important foundation to the strength of our teeth. If the wear and tear of that hard external tooth structure ever reaches the internal hollow core of the tooth, the pulp can become irreversibly damaged. The endodontist starts by examining the patient, and if any symptoms are already occurring, we listen to the symptoms that are present. This gives us diagnostic clues as to whether the symptoms are truly coming from the roots of the tooth or from somewhere else. During the exam, there are images taken of the roots, including a high-resolution 3D scan to see down below the gums and to be able to view the roots in many different directions. Once there is confirmation that the tooth needs a root canal to be saved, we use the latest proven technology with high-powered microscopes to see way down into the canals during the process so that we are able to clean and disinfect the canals with high precision. Everybody knows that all of our mouths have bacteria present, but the bacteria from our saliva are never supposed to reach that internal pulp tissue we talked about. Just like a leak in the foundation of your house, our saliva can leak into even a tiny micro crack in a tooth, and the bacteria can then reach the pulp. So when that deeper leakage happens and the bacteria are able to reach the fragile pulp, if the affected tissue isn't fully removed, the bacteria, and importantly, the inflammation from the bacteria, can spread into surrounding tissues, and this can become a serious health problem. Some people believe that once the core of the tooth is damaged or infected, the tooth has to be pulled. This just isn't true. Saving the tooth with a root canal is typically a high successful procedure that if the tooth is maintained properly, it can last the rest of our life. As you probably know, a lot of dental cavities don't even hurt. Most of the time, the patient doesn't find out about a cavity until they go in for a routine checkup. So once the tooth pain actually occurs, there's a really good chance the problem is deeper than the patient wants it to be. If someone experiences tooth pain, it is wise to get it checked quickly. The quicker the problem is checked, the better the chance we have to save the tooth, and even more importantly, waiting on dental treatment can make the problem serious enough that it could actually become really bad for someone's overall health. Endodontists work closely with family dentists to routinely assess the patient's oral health and find problems before the damage or infection becomes severe. Even though it is an old adage, an ounce of prevention is worth a pound of cure, and that is so true for our dental health. We want to help people keep their mouths healthy, and our goal is to keep the patient's natural teeth strong and infection-free for their lifetime.